It's been more than 1 year now, and we're soon getting to 2 years since we were hit by this global health crisis of COVID-19. According to experts, this has prompted us to turn our attention away from other health crises. For instance, maternal, infant and young child nutrition is a global health crisis that continues to cause childhood undernutrition that leads to slow physical and mental growth. And did you know measles is one of the most contagious and severe childhood diseases? Every day, it takes the lives of hundreds of children around the world. In fact, even if a child survives, measles can cause permanent disabilities such as blindness and brain damage. I'm now sure by the end of this show, you'll know why we must remain vigilant against these deadly diseases. Let's get to it. In Kenya, more than a quarter of children under the age of 5 have stunted growth. Stunting is the most frequent form of undernutrition among young children. If not addressed, it has devastating long-term effects, including diminished mental and physical development. In addition, 11% of children are underweight, with 4% wasted. Key drivers of childhood undernutrition include disease and poor diets, especially between 6 and 23 months. This is due to food insecurity, insufficient care practices, and harmful social norms. Then how do you determine a child is malnutritioned? The mid-upper arm circumference is a quick and simple way to determine whether or not a child is malnourished. Using a simple colored plastic strip, the tapes show color-coded cut-off points indicating various levels of malnutrition for young children. The MUC test can identify children between 6 months and 5 years old who have malnutrition, wasting or thinness and are at risk of dying. Here are some stats. 11% of children in Kenya are underweight, with 4% wasted. So how bad is the situation now, and what is being done about it? My name is Lincoln Ombogo, and I'm not alone. I'm joined by a health expert and gynecologist, Dr. Satbir Karwal, who will help us understand the technical matters concerning malnutrition. Dr. Karwal, thank you for creating time. How has COVID affected in general maternal care?
Hi Lincoln, how are you?
Good.
Myself, I'm Dr. Satbir Singh Karwal. I'm the medical director from Shri Swaminarayan Hospital. Thank you for inviting me here today. Coming to your first question, that how is the maternal care in this era of COVID? What has changed regarding healthcare practices, and what has changed for the patients themselves? Okay, Lincoln, we should start with COVID has put a lot of pressure on the healthcare system. Yeah, this is regarding the staffing. The cost of care has gone up. That is for obvious reasons. All of us need to use personalized protective equipment, the PPIs.
In the hospital that you run, or the healthcare sector in general?
Yeah. No, for the whole healthcare sector in general. You see, the healthcare as such has to be restructured, and it has been done successfully in Kenya already. As if you would go back like 2 years, 3 years back, how the clinics were being run is pretty different than how it is now. Now, from the point of entry of the patient, we normally have a triage system in all health facilities, in ours as well, where we have a basic triage system, where we see if there's a basic questionnaire, a screening tool that has been devised, that is standardized, that is used by all healthcare institutes. We quickly take the patient through the standardized healthcare tool, and we see who is at risk of having COVID or not. If from that basic tool we have some suspect, normally he's isolated, and then the care continues from there. Basically, most of the institutes at the moment, they are having these thermoguns that measure the temperature. They also, we have oxygen pulse oximeters for measuring the oxygen saturation of the patients, and other small things starting from the vitals and the physical exam. Okay. Then from there, once the patient has been triaged, then the next step is followed along the chain, depending on what has to be done. Most of hospitals nowadays are taking patients on on booking. Yeah, it's not like the way it used to be.
Hold that thought right there, Dr. Karwal. Since the pandemic hit the country, the impact of COVID-19 restrictions has had a huge negative impact on access to sexual and reproductive maternal health care services. According to the United Nations Women, this has led to severe increase in maternal mortality that has forced women to seek alternatives for their safety. Our very own Rachel Nduati explains.
Maternal mortality or deaths caused due to complications from pregnancy or childbirth have been on the steady increase. From 2000 to 2017, the global maternal mortality ratio declined by 38% from 342 deaths to 211 deaths per 100,000 live births. According to United Nations interagency estimates, this translates to an average annual rate of reduction of 2.9%.
Lakini tarehe 2 ameanza kutapika, nikachukua jukumu ya kumpeleka hospitali, wakasema pressure iko juu. Daktari alimaintain lakini haikuwezekana. Kufika tarehe 3 saa 12 nikimrutisha hapa, alilala hapa, alikufia tu hapa kwa nyumba.
While substantively, this is less than half the 6.4% annual rate needed to achieve the target Sustainable Development Goal of 70 maternal deaths per 100,000 live births. In Kenya, maternal mortality during or upon delivery continues to be one of the biggest challenges of the healthcare system.
So that time ilini happen ya usiku ile yenye nilipatwa na attempted miscarriage.
Since the Covid-19 pandemic hit Kenya, thousands of pregnant women have been devastated in their quest to access maternal health care. In 2016, Kenya launched the Midwives Association of Kenya in order to help expecting mothers access medical health care. Clearly, there is need for more to be done in order to reduce the high mortality chances on both mother and child.
Karwal, still dwelling on pregnancies, what's your take on pregnant women taking a COVID-19 jab?
Yeah, no, that's a very good question, Lincoln. Yeah, we have to look at the advocacy for COVID-19 vaccine. So far, the government is doing a lot of that in terms of advocacy, which is very important. You know, the myths around vaccination in general, not just for COVID, have to be, removed. Yeah. So what protocols are there in place at the moment? Yeah, as you saw when COVID vaccine came in, initially it was for the elderly above 65.
Yes.
Then the government took the age down and so forth, depending on how many vaccinations we are receiving.
Yes.
Currently, for pregnant women, there are no proper guidelines as such. But if you look at the reputed institutes that make these protocols, including the CDC, the ACOG, that is the American College of Gynecologists, and in the UK, the RCOG, the Royal College of Obstetrics and Gynecology, they all recommend vaccination to be given to the pregnant ladies. There's a reason behind that. You see, pregnant ladies are at increased risk of getting complications from COVID, unlike a normal population. Okay,
pregnant women,
yes, in
are
general,
at risk.
Yes, if they get COVID, they are at a higher risk of getting complications from that COVID infection. So it is very important that these high-risk people are really well protected.
How can mothers improve their pregnancy outcome to reduce malnutrition?
Yeah, that's a very important question. Yeah, Lincoln. Yeah, you see now the way the world is practicing now, medicine is quite different. Yeah. As I'm telling you, for you to get pregnant, it should be planned. You should plan your pregnancy.
It should be planned.
Yeah.
Dr. Karwal, perhaps maybe clearing the air.
Yeah.
Talking of, are you a smoker?
Yeah.
Do you take a lot of alcohol?
Yeah.
Do these things affect both men and women, or is it just the mother?
No, it affects both men and women. Yeah. You see, there are a lot of couples out there. It's very difficult for them to get pregnant. Okay. These are the most of the clients who actually come for these clinics. But that is not what the norm should be. The norm should be that anybody who wants to get pregnant, he should actually come to the hospital just for it's a very friendly clinic, yeah, just to let you know a few do's and don'ts, yeah, and then we take it from there. Okay, once the preconception clinic is done, yeah, then there's a whole format of how the pregnancy should go. Okay, normally we break down the pregnancy into 3 trimesters. Remember, we're talking about child malnutrition, yeah.
Yes.
It's very important how the child comes out from the mother in the first, that's the starting of the life, yeah. Then from there we should monitor how the malnutrition comes up, yeah. So regarding the journey, you see, it's normally divided into 3. We call it trimesters. Normal pregnancy is 9 months, so we can divide it into 3 months. So there are specific things that need to be done in each trimester, okay. And there are guidelines behind that also. Normally in Kenya we follow the WHO, positive pregnancy experience. So what happens in the first trimester, we make sure the pregnancy is a viable pregnancy. If there are any few signs and symptoms the mother is facing, we sort them out. Because remember, the development of the organs of the baby, is basically happening in the first 3 months. So this is a very important period. So this is the period where we take care of about all these things. We do some blood tests just to check that are you at risk of, let's say, HIV, do you have a risk of having syphilis, tuberculosis, what is your blood group, are you at risk of having anemia? So all these assessments are done within the first 3 months.
Thank you.
Yeah.
Thank you, Dr. Karwal. Thank you so much. Let's briefly change gears. There is a refugee camp located on the outskirts of Kakuma town, which is a headquarters for Turkana West District of Turkana County. Kakuma Camp and Kalobeye Integrated Settlement had a population of 196,666 registered refugees and asylum seekers at the end of July 2020. But how is the situation now under a pandemic? We are joined by the head of operations of the Kenya Red Cross Society in Kakuma and Kalobeye, Dr. Michael Ayebe, for a quick health watch and situation on the front line. Dr. Ayebe, thank you for creating time. Kindly paint to us a brief picture of the health project in Kakuma and what is the current population of refugees.
We have nearly 200,000. Beside that, we also have over 500 asylum seekers who are yet to get their refugee status determination done and then taken to the community. So this is the population that we serve, but always under now the new settlement and model is that we also look at the host community, and that's why we look at it as a settlement. So we also look at the host community, and we provide service to nearly 10,000 members of the host community.
Michael, have you been able to bring under control and manage different health emergencies on the ground?
I think we would say it is stable. We cannot say that we have health emergencies there. We are able to provide health services, usually this being a right for both host and refugees. And the plan in Kakuma is that there is a level 4 hospital, which is operated by the International Refugee Committee, IRC. And this is the big hospital where all of us refer patients who require surgery and other specialized forms of treatment. In Kalobeye, we have a health center, which is a level 3A, that is managed by Kenya Red Cross, providing primary health care, so all outpatient services. We also have a maternity that is able to support mothers who are pregnant and want to have children. We are able to provide all the care, and even in the context of COVID, we were able to set up proper quarantine centers, isolation centers, and we manage cases at the time. I can say that the operations regarding health in Kakuma is quite stable at the moment.
Well, COVID has brought numerous challenges. What impact has it had on your operations?
The impact is really huge. Starting from even refugees, we've been able to receive a number of refugees who were urban, what we would call urban refugees, and ordinarily they were able to themselves from in various towns and cities. But now their livelihoods have been cut short. And now on the resources, you look at what you need under COVID situation is that rooms are smaller, the population is high, you want to have this social, the physical distance between the persons who are seeking services, and you do not have that kind of service. We require them to have masks, and one of the challenges we would see is a requirement, but they are not able to buy these masks. We suffered quite a number of incidents where our staff contracted COVID.
And as we conclude, what milestones or achievements have you been able to achieve in the camps?
They are quite a number, and I would say would always put it as a team, because in terms of health, as I mentioned, there are other partners who are working with us. I would say we have, I think, one of the best maternities in Turkana, county. Not just Turkana West, because we've been able to try our best and maintain high standards. We run at the health center on a 24-hour basis.
Thank you so much, Dr. Michael Ayebe, the head of operations of the Kenyan Red Cross Society in Kakuma, and Kalobeye comes for that quick brief. And as we take a quick commercial break, here's what you need to know about postpartum depression that occurs after childbirth.
Most of the people, they are not aware. It's all about the baby blues that comes with giving birth. You don't want to breastfeed even the child. You feel that everybody have annoyed you. If you feel that I have given birth of late and this is happening to me, please consult with your doctor, because it can be treated. If it is delayed, it can bring a long-term issues of mental health. 1 in 10 people, they usually suffer from mental health. 1 in 10. And 1 in 4 patients who seek attention in hospitals, they suffer from mental health. So when it comes to women, what I can say, 80% of women, they experience a bit of baby blues. And of the 80%, 15%, they usually have postpartum depression. They only need somebody to talk to them. They need somebody to be there to help them. Because remember, after you give birth, because of the sleep pattern of the child, you may not sleep. So can I get somebody to help me sleep, even if it's 2 hours during the day? Can I get support from other people?
Measles and rubella remain significant contributors to childhood morbidity and mortality in most rural and urban populations in Kenya and the cause of disease outbreaks in the country. According to national immunization coverage data in the year 2017 of children between the ages of 12 to 23 months, only 65% have been fully immunized. As COVID-19 continues to ravage the world, immunization programs continue to be affected in equal measure, with experts warning that there has been a sharp decline in the immunization program. What then does immunization entail, and how effective is it in curbing the spread of infectious diseases? Shilangatich gives us the details.
Immunization is the process where a person is made immune or resistant to an infection, typically by administration of a vaccine. These vaccines stimulate the body's own immune system to protect the person against subsequent infection. Being immunized means that you're injected with a weakened form of a disease, which triggers the body's immune response, causing it to either produce antibodies to that particular ailment or induce processes that enhance immunity. The Kenya National Immunization Schedule consists of 5 contacts between birth and 9 months. BCG and polio are given at birth, DPT or whooping cough, hepatitis and pneumococcal vaccines commencing at 6 weeks, with the measles vaccine being administered at 9 months. Being exposed to the actual disease-causing organism means your immune system is prepared to fight the infection. Immunization is one of the best ways to protect yourself, your children and future generations from infectious diseases. Vaccination helps wipe out diseases that could spread now and into the future. However, the outbreak of the COVID-19 pandemic is posing as a major challenge in the implementation of immunization programs and has caused a significant decline in the progress. New restrictions place the importance of other vaccinations for children much lower, as many people are staying home to protect themselves from catching the virus. As a result, the impacts are being seen due to lack of consistency in healthcare and immunization. Inasmuch as the COVID-19 pandemic is wreaking havoc in the country, parents are urged to adhere to the immunization schedule, as it is one of the best ways of preventing the spread of infectious diseases. Shilangatich, Switch TV, Nairobi.
Thank you, Sheila. We are now joined by the program coordinator on reproductive, maternal newborn, child and adolescent health, Kenneth Kamande. Thank you so much for creating time, Kenneth. Now, in your day-to-day activities, how many children on average are you able to reach with this campaign?
So during campaign, it's kind of for immunization, first of all, they are twofold when it comes to issues of immunization. We're having the routine immunization activities, and then we're having the campaign activities. So for the campaign activities, there are different factors that come into place. And number one, it's either the geographical area that you're going to target, the number of CHVs you're going to use in that.
What are CHVs?
The community health volunteers, together with the Kenya Red Cross volunteers. At the same time, the Ministry of Health targets that they give per day. So sometimes you might find it might range between 35 to 50 households in a day. And these households sometimes might have the children that we are targeting. Some might not have the children that we are targeting. But at least in a day, we try and see to target at least 35 to 50 households in a day.
And 35 to 50 households, that's enough for
That's enough for a day, because, you know, it has the community health volunteers, they have some questionnaires they need to ask. You as the caregiver, you need to ask questions, you need to be clarified, you need to be given direction, you need to be guided. So you see, in a day, if that is an average, because you need to fill in a form, you need to take the details of the caregiver, you need to give that information. So in a day, at least 35 to 50 households, they're able to attend
in informal settlements.
In informal settlement.
Okay.
Yeah.
We also have the nutrition manager for the Kenyan Red Cross Society, Linet Achieng, joining the discussion. Linet, how has the Kenyan Red Cross Society been able to work closely with the Ministry of Health in supporting immunization services?
Thank you very much. Kenya Red Cross, as a mandated first responder, most of our interventions are at community level. And through our community programs, basically the health and nutrition programs at community level, we've been able to provide integrated health and nutrition outreaches, majorly in the arid and semi-arid counties. And what we do in the integrated outreaches is that we try to have as much integration of the health services as possible. So through the outreaches, we've been able to integrate immunization services. And as we work closely with the community health volunteers, they've been able to mobilize communities where we've been able to identify children who have not been immunized before. We call them zero doses. So these children, when identified, they are referred to the outreach sites where I've been able to support now the ministry to even track defaulters for the same services. And especially during the Covid-19 pandemic, since the pandemic was reported in Kenya, we've really worked closely with the Ministry of Health to ensure that these children continue accessing immunization services through the integrated outreaches.
Kenneth, what are some of the responses that you receive on the ground and the challenges that perhaps you experience on the ground?
Sometimes it's not more of a challenge, but sometimes it's an issue about getting the information, because sometimes what we get on the field is out of ignorance, because most of them may not have the information what you're doing. They might know what is the cases that maybe in terms of the given different vaccines that are being given. For this case, I might do a comparative of between two vaccines that are being given now. That is the measles vaccine and the polio vaccine. So you find for the polio vaccine, they have the laxity, where you find that the healthcare workers are able to come at your household level. But when it comes to measles, this is where we have, because it's an injectable, we're having stations, either within a facility or a fixed point. So you see, at the end of the day, the mother will want to enjoy the same services that they're having with the polio. But for this case, so sometimes it's not an issue about majorly about challenges, but it's just an issue about for them not to understand where they need to take their children.
Kenneth, what are some of the responses that you receive on the ground and the challenges that perhaps you experience on the ground?
Sometimes it's not more of a challenge, but sometimes it's an issue about getting the information, because sometimes what we get on the field is out of ignorance, because most of them may not have the information what you're doing. They might know what is the cases that maybe in terms of the given different vaccines that are being given. For this case, I might do a comparative of between two vaccines that are being given now. That is the measles vaccine and the polio vaccine. So you find for the polio vaccine, they have the laxity, where you find that the healthcare workers are able to come at your household level. But when it comes to measles, this is where we have, because it's an injectable, we're having stations, either within a facility or a fixed point. So you see, at the end of the day, the mother will want to enjoy the same services that they're having with the polio. But for this case, so sometimes it's not an issue about majorly about challenges, but it's just an issue about for them not to understand where they need to take their children. Yeah.
And perhaps maybe we can ask Linet, What are some of the challenges that she has been facing providing better nutrition, especially now during the COVID-19 pandemic?
When the pandemic was reported in Kenya in March 2020, attention and priorities shifted a lot to the response to the pandemic. You remember at the same time we had the worst locust invasion reported in the last 70 years. So priorities shifted to response to COVID-19 pandemic. The government put up measures to control the spread of the pandemic. We had movement restrictions imposed. We also had restrictions governing public gatherings. And as I've mentioned, most of our activities are community-based. So we really had a challenge, especially delivering health services at that level. Since the public gatherings were banned, you remember when we have the integrated outreaches, we bring people together. Since we have an integrated package of interventions, we have health education sessions. We also have mothers bringing in children for the various services. So we really had a challenge delivering services to these communities. The other challenge we've been facing is that initially when the pandemic started, there was not much information available to the communities. There were a lot of myths and misconceptions around the pandemic. So you find that communities really feared going for health services at the facilities and even at the outreach sites. For one, they had a fear of getting infected. They also had a fear of maybe they could be tested for the disease. And then you remember that time we were still having the quarantine centers. So they were really afraid of accessing health services in the facilities and even at the outreach site.
Thank you, Lynette. Well, Kenneth, what happens when you come across parents who are skeptical? They fear taking, their children getting immunized. Yeah. What happens in such a situation? And you know that it is important for the growth of this child.
So most of the time what usually happens, because now, as I said, we work with community health volunteers together with Kenya Red Cross volunteers. So for this case, we always have someone who always oversee the volunteers, maybe someone from the healthcare, from the Ministry of Health. This is now at the sub-county level, who are now, we call them Sub-County Health Management Committee, where we're having a focal person on issues of immunization. So for this case, in any time when we're having these issues, once the volunteers are not able to address that issue, they're able to escalate to the guys from the sub-county level. Once they're not able to achieve that, then there's always an option of doing the administrative. But for this case, as Kenya Red Cross, because our mandate has always been on the social mobilization, we have never reached to that point whereby we are finding mothers have refused to take in their children for that immunization. Yeah.
Thank you so much, Ken and Lynette, for creating time. And we thought we come to the end of the show. We'll leave you with this interesting expert view explaining whether you should get the COVID-19 vaccines if you're pregnant. Remember, as always, stay safe and see you next week.
Because the vaccine has not been tested on people who are pregnant, the general consensus is that you have to look at other factors and other pre-existing risk factors for the patient before you can decide. So the risk has to outweigh the benefit. The benefits, have to outweigh the risks, in the sense that, let's say if someone is diabetic, they are pregnant, and they have other underlying risk factors, then they should get the vaccine. But data from the CDC reports that really there's nothing that has been seen that is wrong. It's just because, in medicine, we practice evidence-based medicine, whereby it has been tested on pregnant women before we can say that it's a general recommendation on the same. But so far, the data is solid randomized trials have not been carried out on women who are pregnant, but in special circumstances, it has actually not been shown to be harmful per se. But I think we need more data, and this is a new virus. We're not really very clear about the vaccine in the long term, particularly on the unborn child.